Now is the introduction to the cellular events that occur in cases of inflammation. We know that the microvasculature becomes more permeable. حكينا إن one of the vascular changes is increased vascular permeability, and this will cause protein-rich fluid to move into the interstitial area or extravascular area. This increased vascular permeability to the fluid and proteins cause the red blood cells in the flowing blood to become more concentrated and thereby increase blood viscosity. Increased blood viscosity will slow the circulation. This change is reflected ممكن راح نشوف under the microscope many capillaries that are engorged with RBCs, and this is called stasis. As stasis develop, this will cause the leukocytes to align themselves at the edge of the blood vessels in order to exit the circulation. And I will talk later about the vascular changes, cellular changes in details. The cellular events in acute inflammation are divided into two components: the leukocyte accumulation or recruitment, and also leukocyte activation, which is important for phagocytosis of the causative agents. We have seven steps and seven cellular events in cases of inflammation. The first event includes margination of the leukocyte to the endothelial surface, along with a transient adhesion between the leukocyte to the vessel wall. This is followed by firm adhesion of the leukocyte to the endothelium. Then we have transmigration of the leukocyte between the endothelial cells. After that, there will be a migration of the leukocytes through the interstitial tissue, and this process is called chemotaxis and mediated by many chemotactic stimuli. After that, we have the fifth event is called leukocyte activation, followed by phagocytosis of the particle, and this followed by killing and degradation of the particle. I said that when stasis develops, the leukocyte will accumulate at the periphery of the endothelial cells, which is called margination. The margination is followed by what's so called rolling. Rolling means weak attachment between the endothelial cells and the leukocytes, which lead to detachment and binding again. There are certain molecules that are important for the process of rolling, and these molecules are called selectin molecules. The types of selectins, we have three types of selectins. We have what's so called CD62E, and this type of selectin is present on the endothelial cells. We have also P-selectin, which is CD2P, which is present on endothelial cells and platelets. The last type of selectins is L-selectins, which is called CD62L, which is present on most of the leukocytes. After a weak and a transient adhesion between the leukocytes and the endothelial cells, there will be firm adhesion between these leukocytes and endothelial cells. And the firm adhesion is mediated by receptors that are called integrins. Integrins, they are expressed on the surface of the leukocytes and they interact with ligands on the surface of endothelial cells. The integrin molecules, they are normally expressed on the leukocyte surfaces. But this normal expression, they are normally expressed in low affinity forms. But to adhere to their ligands on the surface of endothelial cells, they should be expressed on leukocytes in high affinity form. And this high affinity form is stimulated by a presence of chemokines, which are chemoattractant cytokines. When the adherent leukocytes when they encounter chemokines, the cells will be activated, and when the leukocytes activated, they undergo conformational changes, forming what conformational changes, and these conformational changes lead to clustering of the leukocyte together, converting to high affinity forms. The endothelial cells are stimulated by certain cytokines, which are tumor necrosis factor and interleukin 1 to increase their ligands for the integrins. The ligands for the integrin include the intercellular adhesion molecule 1, which binds to the integrin called LFA1. The intercellular adhesion molecule 1 is called ICAM1. Another ligand for the integrins is vascular cell adhesion molecule 1, which is called VCAM1, and it binds to the integrin VLA4. The results of presence of integrins in high affinity form and also the increased expression of their ligands, the net result is formation of stable attachment of the leukocytes to endothelial cell surfaces at the site of inflammation. After stable adhesion between the leukocytes and the endothelial cells, the leukocyte will squeeze them cells between or at the intercellular junctions, and this process is called diapedesis. Diapedesis is present at the venular side of the systemic circulation and the pulmonary capillaries. Then a migration of the leukocyte is activated by chemokines that are produced by the extravascular tissue, leading to migration of the leukocyte to the site of inflammation toward a chemical gradient or what's so called chemotactic factor. There is a cellular adhesion molecule which is important in the process of diabetes called BCAM1 or CD31. And this molecule is present on the leukocyte surfaces and endothelial surfaces, and it mediates the binding which is needed for the leukocytes to traverse the endothelium. After transmigration from the endothelium, the leukocyte will face the basement membranes of the endothelial cells, and to pass through this basement membrane, the leukocytes will secrete certain enzymes like collagenases, which degrade the basement membranes. The next cellular event is called chemotaxis, and after transmigration of the leukocytes through the endothelium, the leukocyte will migrate to sites of injury by infection or necrosis, and this migration occurs along a chemical gradient, and the whole process is called chemotaxis. This chemotaxis is activated by chemotactic agents. The chemotactic agents include bacterial products, then cytokines, which are called chemokines, and products of complement system, mainly C5a, and products of the lipooxygenase pathway of the arachidonic acid metabolism. The main one is leukotriene B4. So the chemotactic agents are the bacterial products, chemokines, C5a, and leukotriene B4. The infiltration of the leukocytes at sites of injury. This infiltration occurs due to the action of combinations of factors or mediators which are called chemotactic factors, and these chemotactic factors might be present in circulation or released from the leukocytes, and these mediators, they are secreted due to presence of infections and presence of tissue necrosis or damage and presence of immunological reactions. The type of infiltrating or immigrating leukocyte, it varies with the age of the inflammatory response, if it is acute or chronic, and also depends on the type of stimulus. The type of leukocytes in bacterial infection differs from the type of the leukocytes that are present in viral infection. In acute inflammation, the main infiltrating cell is the neutrophil, and it predominates in the first 6 to 24 hours, to be replaced by the monocyte or the macrophages in 24 to 48 hours. Now, what are the reasons behind the fact that the neutrophils predominate in cases of acute inflammation? There are many reasons. We know that the neutrophils, they are more numerous in the blood, more than the other cells, and also due to the fact that the neutrophils, they respond more rapidly to the chemokines. In addition, the neutrophils, they attach more firmly to the ligands that are present on the surface of endothelial cells, like the P-selectins and E-selectins. Then the neutrophils, they are short-lived in tissue or tissues and usually die by the process of apoptosis and disappear within 24 to 48 hours to be replaced by the macrophages or the monocytes which survive more or longer. But there are exceptions to the fact that the neutrophils, they are the predominant cells in cases of acute inflammation, and the exceptions include in cases of viral infection, the predominant cells are the lymphocytes, and in parasitic infection and hypersensitivity reactions, the eosinophils, they predominate. Regarding the leukocyte activation, the leukocytes will be activated at the site of infection or any cause of tissue damage like necrosis, and therefore the leukocyte will be activated and perform their functions. And the stimuli for leukocyte activation include the microbial infection, the product of necrotic cells, and chemical mediators. Regarding also the leukocyte activation, the induction of number of responses in leukocytes that are considered part of their normal defensive function is produced by engagement of the receptors of the microbial products or chemical mediators of inflammation. The activation of the leukocytes will cause many enhanced functions like the phagocytosis of the particles along with elimination of the harmful agent or substance. Also, the leukocytes, they produce substances that destroy the phagocytosed substance like the microbial organisms and dead tissue, and these products include the lysosomal enzymes along the free radicals, which are oxygen free radicals and nitrogen free radicals. Also, leukocyte activation results in production of mediators that will increase or amplify the inflammatory reaction, and this amplification is mediated by the substances which are called cytokines. Regarding phagocytosis, it includes three steps. The first step is recognition and attachment of the microbes or dead tissue to the ingesting leukocytes. And this is followed by engulfment of these particles with subsequent formation of phagocytic vacuoles, and this will be followed by killing and degradation of the harmful agents by the lysosomal enzymes of the leukocytes along the free radicals like nitrogen and free radicals or oxygen free radicals. We know that leukocytes, they bind and ingest most microorganisms and dead cells by specific receptors that can be components of the microbes and dead cells or can be host proteins which are called opsonins. The process of opsonization includes covering or coating the microbes or dead cells by proteins derived from the host, and these are called, as I said, opsonins, and these opsonins, they facilitate the phagocytosis.